Now, as you manage this, when you start suspecting COVID or SARS-CoV-2 in a clinical environment, you use your N95 respirator. If you don't have, use a surgical mask. But we know that there's a difference between these two. Surgical mask in the context of airborne disease like tuberculosis or any other airborne disease are used by patients, people who are infected so that they keep the bacillus to themselves. Um, but your respirator does both. You would keep to yourself if you have any bacillus, but any particles of the size of between 1 to 10 microns will be blocked, will not go through the respirator. That's why it's called a respirator. N95. 95 means 95% filtration efficiency. This targets particles of those of a size between 1 to 10 microns. That's why you say 95% filtration efficiency, as we call N95. This is an American NIOSH thing. Europeans have FFP2, which is equivalent to N95. We're used to N95, but FFP2 is equivalent to N95. So this is what really healthcare workers need to do. Protect themselves, separate patients. Don't keep patient whom you think could be having coronavirus, share the waiting area with other patients. They infect all your patients. You need to educate them on how to cover the nose, because that's the time when they're still able to listen to you. If you wait till the diagnosis is positive, people are depressed, you start educating them, is a waste of time. Hand hygiene is very important, but also think about early initiation of supportive therapy. It may be necessary in clinical environment. Now, in terms of laboratory diagnosis, once you suspect, is either a PCR test that is done. We know that after doing the PCR for a couple of weeks, we receive some cartridges that are used for GeneXpert cartridges. So this is the machine that is traditionally used for tuberculosis diagnosis. There are more cartridges now for coronavirus. We know that there's also cartridges for HIV. So like I was saying, this is like a coffee machine that has that helps you make tea or milkshake or whatever drink you want to make. So the machine is a wonderful technology. The cartridges are very important. We come back to the samples later. But what I can say at this point in time is that the antibody tests that have a potential to be point of care are not yet in place. So we have to wait, because GeneXpert and PCR tests are done far away at labs that are far away is a bit of a problem. But when we get antibody tests, it will help a lot with decentralization of testing and all that. So these antibody tests are not yet validated. So we wait. Research is still going on. And when we hear something, we will let you know.